Welcome to our FD Live session. Today we have with us Dr. Jayalakshmi TK, Consultant Pulmonologist, Apollo Hospital, Navi Mumbai. Today we will talk about monoclonal antibodies. So doctor, we have heard that there is a new treatment for COVID-19 which is now available in India and which was even taken by President Trump. So doctor, can you please tell us more about the same?
Hello, viewers. This new treatment is called as a cocktail therapy or a monoclonal antibody cocktail treatment, and it is mainly advised for those who are at high risk for developing more severe illness, like for example, patients who have heart disease, lung disease, or who have kidney disease, who are elderly over the age of 65, or who are age of over 55 but with hypertension and diabetes, or those who have severe obesity with BMI more than 35. It's advised for this subset of patients, and it is given in the OPD basis in the first week itself of the illness.
Doctor, which patients are suitable for it?
So, as I mentioned, it is mainly for those who are at a high risk for developing more severe risk of who are at high risk for having more severe illness, like patients with underlying kidney disease, heart disease, lung disease, or who are immunosuppressed, or those who are on chemotherapy. So in these patients, when they get infected, when they are initially in the asymptomatic or the mildly symptomatic stage, this is the time when they are eligible to take this monoclonal antibody treatment.
Doctor, what are the contraindications?
So there are no real contraindications for this treatment except if the person has already had a severe allergic reaction to the same injection.
Doctor, what are the possible side effects of monoclonal antibody treatment?
So usually there are no side effects. It is safely tolerated. But rarely you can see an anaphylactic type of reaction. That is, at the time when the injection is administered itself, patient may get a severe allergic reaction like a rash or itching or low BP. So in order to take care of this injection is administered in our hospital in the emergency department itself under observation, and even after administering the injection, patient is observed for an hour to see for side effects, and then the patient is discharged and sent home. Other rarely side effects can be itching, nausea, chills, body pains.
Doctor, does it cover against all the variants of COVID?
As of now, it covers against the earlier detected variants like the Brazilian variant, South African variant, the UK variant, and also the newer studies are showing that it is covering against the Delta variant as well.
Doctor, how does it work?
So basically, these are antibodies produced in the patient's plasma, uh, and these antibodies bind to the virus. It binds to the spike protein of the virus. On the spike protein of the virus, there is a receptor binding domain, which is the part which binds with the receptors in the human body. So this antibodies bind against against the spike protein in that domain, so that the virus is not able to bind to the ACE receptors on the human in the human body. Thereby, it prevents the virus from multiplying in the human body, reduces the viral load. It is shown to significantly bring down the viral load in the human patients in whom it is administered.
Doctor, can it be given in pregnant patients?
It can be given in pregnant patients as well. Also, it has been authorized to give in children about 12 years of age.
So, doctor, can you please summarize for us?
So to summarize, this is a new treatment which is available. It's called as a cocktail treatment. It's a monoclonal antibody cocktail which usually consists of two variants of monoclonal antibodies. These are antibodies which are normally present in the patient's plasma and which has been grown and multiplied to form a concentrate. This concentrate is administered intravenously, can also be administered subcutaneously, is given to patients who are in the first week of the illness. It's usually administered in the OPD, or in our hospital it's administered in the emergency room. Usually it is an IV infusion of half an hour to 1 hour, and the patients can go home after taking the infection. It is given to those who are at high risk for developing more severe illness. Patients who are at high risk are those with pre-existing heart, kidney or lung disease, or who are elderly, or who are obese, or who have other severe medical problems. And the treatment is given, the treatment has been shown to reduce the chances of developing more severe illness by 70%, and to reduce the chance of getting significantly serious illness which may require hospitalization and even death. So if you or your relatives have been recently diagnosed with COVID, kindly find out from your nearest Apollo center whether you are eligible for the new monoclonal antibody therapy treatment. Thank you.